Let's go through some of these, Dr. Koehne, and I know a few we've mentioned, but now we can really focus on them. First one, obviously, being the blood test and a urinalysis.
Yes. Well, that's as I said earlier on, that gives it away, particularly which test you would like to do afterwards. So the blood test will indicate whether or not you're suspicious of a leukemia, multiple myeloma,
Right.
or a lymph node, a swollen lymph node that is not painful in comparison to an infectious lymph node, will lead to a lymph node biopsy. And based on those results, you most likely will have to add other tests like imaging tests, a PET scan, a CAT scan, MRI.
And these are commonly done. We saw that in the story.
Yes,
He had a
yes.
CAT scan done.
Yes, they are routine assays and tests that we are performing for establishing the diagnosis, but also for establishing the spread of the disease, so what we call staging.
Okay. Yeah, let's talk about staging quickly. Are there stagings for both blood cancers and bone marrow cancer? Or
very different. So staging
Okay.
for leukemia is basically not existing. But what is important for everybody to know that one leukemia is not the same, and even within the same leukemia, there are different risk categories.
Right.
So the staging for the leukemia, I call them risk stratification, because you need to know from the beginning, based on molecular studies, which we haven't talked about, how aggressive is your leukemia and how it intense need to be treated, this disease to be treated. Staging is more important for the non-Hodgkin lymphoma and the Hodgkin's diseases, because they can be very localized to one lymph node, or they can be all over your body and the lymph nodes, including the spleen and the liver involvement, and which would make it a more aggressive stage 4 disease.
Right.
And then you look into the bone marrow to find out whether or not there are also malignant cells in the bone marrow.
Is that when you do a bone marrow biopsy?
Yes. Yeah, you would do that in all of these diseases. You would like to know whether or not the bone marrow is involved.
Okay.
And leukemia usually derives from the bone marrow and goes outside of the bone marrow into the blood. Non-Hodgkin's diseases or Hodgkin's lymphoma derived more from the lymph nodes and go into the bone marrow.
Right.
And the same thing for the multiple myeloma, more or less.